Let's talk about anxiety. Let's talk about you and me. Let's talk about all the good things and the bad things it may be. Let's talk about anxiety. Hey guys. Alright, I want to give you guys a disclaimer before I start this video. This may be triggering to some people because we're going to kind of think of a memory that is not great. So it would not necessarily be a huge trauma necessarily, but something that has affected you even as an adult, that can kind of trigger like that unpleasant feeling. This is not therapy, so I don't want you to think that this is like a therapy session. I'm going to explain to you how unpleasant situations such as traumas affect our memory, and particularly like our hippocampus where the memory is stored. So I'm going to do a little experiment with you after that disclaimer, and we're going to think first of something that's positive, an experience we had, and then a negative experience that we've had. So our positive one is usually like a celebration, an anniversary, a prom, like the first day of college, like anything that was really a memorable experience for you where you're like, yay, this is awesome. So I want you to think about that and get kind of your idea of what you're going to use in your head. Okay, and then we're going to see if we can start at the kind of beginning of the day, your first part of your memory for that, and see if you can walk yourself through that day. Like, how did it start? Who were you with? Where did you go? Was there a pre-party or a pre-celebration, a luncheon, something like that? Who helped you get ready? Then the actual event, kind of move through that event, and then what did you do after that? Who were you with? What did you see? Did you guys go eat afterward? That kind of thing. So I'm going to give you a minute and just kind of walk through your day that day. Good. If you need to pause me here, you can, just to continue to do that. But we should have kind of just seen how our day flowed. Excellent. Now we're going to think of a more negative experience. So it doesn't have to be a big T, like a big trauma that happened to you. It could be a small T. It could be a big T if you feel comfortable kind of recalling that. But just a negative experience that you've had. And when I say little t and big T, for little t I mean like traumas that happen regularly as you grow up. So maybe you grew up with someone with a mental health issue or an addiction problem, some other kind of thing that happened on a regular basis as a child. Or it could be a big T, like a car accident that you were involved in or something like that, like a one-time event that was traumatic. So you can picture a little t or a big T or just some kind of negative experience that you have had. Like I said, this is not therapy. We're just doing an experiment. So have your kind of idea of what that is in your head. Okay, and now we're going to walk ourselves the same way we did with our positive experience. So walk yourself through and see if you can kind of see what happened in that day. Okay, and like again, if you need to pause this, that's totally appropriate. All right, so what I want to know is, when you think of your positive experience, was that linear? So did you have a beginning of the day, middle of the day, when the event happened, the end of the day kind of thing? Did it follow kind of a timeline for you? For most of you, it probably did. The negative experience, how was it? Was it just snippets, like a conversation, maybe what someone was wearing, maybe a few words that you remember, maybe a few visual like snaps of something that's happened? Okay, so I'll explain kind of what that is. So whenever we experience a traumatic event, our brain stores those very differently than our positive experiences. Our positive experiences are stored in our hippocampus, and that just kind of is where we store all of our linear good stories and things that we really want to remember as the event. Things that are negative, we store in a different part of our brain, back in our hind part of our brain that we talked about before with our hand-brain model. And that's because the brain doesn't need to store all of the information. The brain needs to store things that can protect you the next time something like this happens. So for instance, if I'm going to recall a car accident, I'm going to remember that road was wet, it was dark, there was a tractor trailer coming from behind me. I remember lights. But I don't remember what I did that day. I don't remember actually what I did after that. But my brain stored that in a way so that next time the road is wet, okay, got it, right? Or, I see oil spots in the road, got it. I don't need to know the full story of what happened. So that is why people who are in the little T zone, the trauma as you grow up, why our memories are more challenged than people who have grown up without the little T's as they grow up. So little T's kind of cause that part of our brain to be more active, and we have more memories of things that can help us remember a trauma and avoid that trauma, or know how to fight it, or know how to respond next time we hear that sound, that smell, that voice, whatever it is. And maybe it's like you have someone growing up in your family who drank a lot of alcohol, so the smell of alcohol can trigger those memories suddenly, because that helps you to stay safe and to stay out of the room around people who were drinking, for example. So, good experiences, linear memory. Bad experiences, we have more sporadic memory to help us just learn the triggers. Now, another thing that happens is that whenever we are in this zone and we are triggered, the front part of our brain is not online, and we're remembering just snippets of thing that is going on just so we know how to fight, or freeze next time that it happens. Our cortisol level in our brain is way going out of control, because our cortisol is our hormone that lets us know we have to fight, run, or freeze, right? Fight, flight, or freeze. So our cortisol level is pumping oxygen more into our lungs. It's getting our sugar in our body more so that it can go and pump to our muscles so we can run faster and our heart can beat faster. So that cortisol is kind of an addictive hormone in our body. So if you're feeling that as you grow up, you're someone who may enjoy skydiving or doing things that's kind of on the edge because your brain likes to have that adrenaline rush because it's just used to that, which is fine. That's a great healthy way to experience life if you're someone with little T's. So that's okay. But what I'm wanting to say is that that hormone actually kind of takes over your hippocampus. So whenever you have that many memories and your cortisol is always firing off, then it's like a shrub. So we're growing a shrub and we're like, no, we're going to prune it just exactly the way we want this to look. Think like Edward Scissorhands. We want to prune it just the way we want it to look, and then it grows a little bit more. We're like, nope, pruning it back down. Where cortisol kind of does that. The hippocampus is like wanting to grow good memories. The cortisol is like, nope, we don't need that right now. Nope, we don't need those right now. Nope. So that makes your hippocampus the memory part for your linear memories. It makes that part of your brain kind of willowed down, and not be as big and not be as strong as the other part of our brain. So whenever we are trying to remember our studies in school, or just like what we did last week, we're like, why can I not remember that? Well, if you're someone that has a lot of little T's, a lot of aces in your life, your hippocampus may not be as strong as people who don't have as many aces in their life. So what do? You have to grow that part of your brain. What is amazing about the brain is that it grows. Like whatever you use, it will grow bigger and bigger and bigger. So if you are noticing that your memory is struggling, do things to help with your memory. So start to make lists, and then once you make lists, start to like think, okay, I'm going to try to do this list without taking the list with me, or I'm going to try to do it without looking at it more often. Do memory games, do those little puzzles that you can do on your phone to help with memory, and then visually attach things in your day. So when you see something, you're like, ah, I want to remember that. And take a minute and come to your senses again. So take a minute and say, oh my gosh, that was a really magical experience today. I really want to remember what I saw, what I heard, some things that I felt, some things that I smelled, some things that I tasted while I was there. And if you can actively put those things together and be mindful in your day, then you can start to grow that linear brain, and your cortisol can start to kind of decrease because you're being more mindful. So you can grow it back, which is awesome. If you feel frustrated about your memory, that's okay, because there's a way to grow it back, and there's a way for you guys to see it on the other side and have a better linear brain than a trauma brain. All right, guys, if you have any questions, just put them below, and I'll see what I can do to answer them. All right, have a great day.